I want you to do something right now before we go any further. Look down at your hands. Really look not at the skin, not at the veins. Look at your fingernails and tell me honestly, have you ever really looked at them before? Because I'm a neurologist, a brain doctor, and the first thing I'm asking you to examine today is your nails. It seems almost backwards, doesn't it? But after decades of caring for patients over 60, I've learned something that still surprises people. Your nails cannot lie to me. Your words can be careful. Your smile can be brave. You can walk into my office and tell me you feel wonderful. But your nails will tell me the truth quietly, whether you want them to or not. Over the years, I have shaken hands with patients, glanced down at those 10 small windows, and seen something that sent me searching for a problem deep inside the body, a problem no test had caught yet, but one that, found early, could change the next 10 years of a person's life. I'm Dr. Thomas Reynolds, and for most of my career I've worked with people, over 60 people, who want exactly what you want: to stay sharp, stay steady, stay independent, and keep living on your own terms. One of the first lessons I learned as a young doctor was humbling. The most important clues aren't always in the brain scans or the lab reports. Sometimes they're sitting right in front of me in the hands I shook at the door. Today I'll teach you to read your own hands the way I read them, because after 60, for specific changes in the nails can be the body's quiet way of saying that something underneath deserves attention. Here's the road ahead. I'll walk you through 4 nail changes you can check at home in about 60 seconds. We'll start with the most common and happily the most fixable. Then the ones that deserve a little more respect, and we'll finish with the one that, when I see it in my office, makes me stop and act, not shrug, by the end. You'll know what to look for, what it may mean, what to do about it, and when it's time to call your doctor. Knowledge isn't meant to scare you. Knowledge is meant to protect you. Before we begin, let me talk the way I would in my office. Leave your age and tell me where in the world you're watching from. And tell me, have you ever noticed a change in your nails, a pale spot, a groove, a curve, and quietly wondered whether it meant something? If you have, you're not alone. That question is exactly why this video exists. Let's start with change number 1, the one I see most often, especially in patients who are exhausted and don't know why. Hold up your hand, palm down, and imagine a single drop of water sitting on the nail. On a healthy nail, that drop beads up like water on a freshly waxed car. But on some nails, the center has begun to dip, a shallow curve, like a tiny spoon, and the drop pools in the middle instead of standing on top. That's where the medical name comes from: koilonychia spoon nails. Here's what's really going on. Your nails are built by living cells working around the clock. Those cells are hungry workers, and their favorite fuel is iron. When iron runs low, the factory slows, the nail grows thin and soft, and the edges curl upward like a roof that's lost its beams. But here's the part most people never realize. The nail isn't the only thing that factory feeds. The same iron that hardens your nails is the same iron your body uses to build hemoglobin, the little delivery trucks in your blood that carry oxygen to every organ you own, including your brain. So when I see spoon nails, I don't just think about fingers. I think about the person behind. Them, the person who's tired by 3 in the afternoon, who's been a bit forgetful lately, who gets winded on the stairs that used to be nothing, who has that restless crawling feeling in their legs at night. All of it can trace back to the same shortage: low iron. And after 60, this shortage becomes far more common than people assume. Digestion changes as we age. Stomach acid declines. Absorption weakens. Common medications, including everyday blood thinners, can cause slow, silent blood loss over months. And many of us quietly eat far less iron-rich food than we did in our younger years. Put it together, and you have a perfect recipe for a very common problem that hides behind a very common complaint: I'm just tired. I'm just getting older. But here's the good news, and it's real. Of all 4 changes today, this one is the friendliest. In most cases, it's treatable, and treating it can give you back energy you had forgotten you ever had. So what should you do? Please hear me. Don't run to the pharmacy and start swallowing iron pills on your own. Too much iron is a problem of its own, genuinely dangerous for certain people. Instead, mention the spooning to your doctor and ask about 2 simple blood tests, a complete blood count and something called ferritin, the warehouse where your body stores iron, which tells us whether the shelves are stocked or empty. If your iron is low, your doctor will guide you safely. Meanwhile, lean on food, lentils and beans, dark leafy greens like spinach. And if you eat meat, modest amounts of lean red meat. And here's a tip most people never hear: pair iron-rich foods with vitamin C. A glass of orange juice, some peppers, a tomato, because vitamin C helps your body unlock the iron in your food. And keep tea, coffee, and heavy dairy away from that meal, because they can lock the door instead. One honest note before we move on: even after your iron returns to normal, your nails won't change overnight. Fingernails grow about 3 millimeters a month, the width of a grain of rice, so a whole nail takes about 6 months to travel from base to tip. The smooth nail you're hoping for will arrive in its own season, like a harvest. But here's the beautiful part: that new nail growing in from the base is proof you can watch with your own eyes, real-time evidence that your body is repairing itself. And that brings me to change number 2, because sometimes the message isn't in the shape of the nail, it's in the color. Take another look at your nails, this time at their color. A healthy nail has a soft pink glow, and that glow is simply blood flowing through the tissue beneath the nail plate. Now imagine a nail turned mostly white, pale and milky across nearly the whole surface, with only a thin band of pink holding on at the very tip, like a glass window painted white, with a strip of color clinging to the bottom edge. That pattern has a name: Terry's nails, after the physician who first described it in the 1950s. For decades, doctors have understood it as one of the body's quieter alarm systems. Let me show you what's happening. Think of the nail as a window, and the tissue underneath the nail bed as the paint. The pink you see is the paint. In Terry's nails, the paint fades, blood flow to the nail bed changes, and the tissue below grows thicker and paler. Something upstream is altering circulation, and in older adults, the most common culprits behind that faded paint are the liver and the heart. Terry's nails are a classic clinical clue in chronic liver disease and cirrhosis. They're also linked to chronic heart failure, diabetes, and kidney disease, sometimes more than one at once. Now, why would a brain doctor care about your liver? Because your liver is your body's filtration plant, the facility that cleans the blood before it continues its journey. And that blood goes everywhere, including straight to your brain. When the filter weakens, waste products build up in the bloodstream, and a struggling liver shows up as fog, confusion, a slow dimming of the mind. What my patients often describe as just not being quite themselves. So when I see Terry's nails, I'm not only thinking about the liver, I'm thinking about the mind behind the eyes. And here's the truth everyone over 60 needs to hear. Liver disease and heart failure are masters of disguise. They don't arrive with sirens, they arrive as just a little more tired, a little swelling in the ankles, a whisper of "not myself lately." Months pass, sometimes years, before anyone thinks to look deeper. So if you see this pattern, here's what to do. Don't diagnose yourself in the bathroom mirror. The same pale look can appear for simpler reasons, and your doctor is the one to sort it out. But take it seriously enough to mention at your next visit, and don't wait if it appeared suddenly. A simple panel of blood tests: liver enzymes, kidney function, blood sugar, a basic heart check can usually answer the question in a single afternoon. In the meantime, you can do your liver and your heart small kindnesses every single day. Drink enough water, ease back on alcohol, keep an eye on sugar, and keep moving. Even 10 minutes of walking counts. These aren't grand gestures. Their maintenance, and maintenance is what keeps a house standing for decades. Remember, noticing is not the same as diagnosing. Noticing is what protects you. Diagnosing is what your doctor does with you, not to you. And that leads me to change number 3, my favorite of them all, because it's like reading a diary your body wrote without ever telling you. Run your finger slowly along your thumbnail from base to tip. Feel how smooth it is? On some people's nails, that surface isn't smooth at all. There are grooves, horizontal lines, like the ridges on corrugated cardboard or the growth rings of a felled tree. One groove or two or several, and here's the intriguing part, all sitting at the same height across all 10 nails. Those lines have a name, Beau's lines. Named for a 19th century French physician, they are one of the most fascinating signs in all of medicine. Here's what most people get wrong about them. Beau's lines aren't caused by damage to the nail itself. They're caused by damage to the factory that makes the nail matrix, hidden at the base, under your cuticle. When your body goes through something severe, a high fever, a serious infection, a surgery, a heart attack, a stroke, chemotherapy, a stretch of serious illness or starvation, the factory temporarily shuts down. Production pauses. No new nail cells for a while. Then, when the shock passes, the factory restarts and that little groove gets pushed forward month after month toward the tip. Because fingernails grow about 3 millimeters a month, a groove sitting in the middle of a nail tells me roughly that something shook your body about 2 to 3 months ago. Your nails are a diary. Beau's lines are the entries you wrote on days you had no idea you were writing. Why does this matter after 60? Because the events that pause the factory become far more common as we age. A bad flu, a hospitalization, a surgery, a serious fall, even profound emotional stress, grief, worry, upheaval can leave its mark, and one cause deserves special attention. Unrecognized diabetes, chronically high blood sugar disrupts nail growth, and many older adults carry diabetes for years without knowing it. So when I see grooves appearing again and again with no obvious explanation, I start thinking about blood sugar. And sometimes Beau's lines tell an even quieter story, the story of a silent heart attack, one that produced no chest pain at all, just a strange weakness and fatigue. In my career, I've known patients who discovered years later that their heart had been through something they never felt. Their nails had kept the date. Now hear the reassurance. One groove after a bad illness is common, normal, and almost always harmless. It's your body's biography. But repeated grooves with no clear cause, especially alongside tiredness, thirst, weakness, or feeling different, deserve a conversation with your doctor. A simple test called the A1C measures your average blood sugar over about 3 months and can help answer the diabetes question. To support healthy nail growth, protein and zinc matter foods like eggs, fish, beans, nuts, and seeds can help. Keeping your hands moisturized also helps nails stay flexible instead of brittle. Here's another practical trick. Every few months, take a photo of your hands in the same light. Over time, you can see whether those lines are growing out and fading or whether something new is appearing. Calm, curious attention is one of the best ways to stay ahead of problems. And before the final change, let me ask you for something small. If this video has felt like a real conversation, like a doctor actually sitting across from you instead of an algorithm talking at you, then do me one favor. Subscribe and tap the notification bell. I make these health conversations for people who want to protect their health after 60. It costs you nothing, and it helps me keep doing this work. Thank you. Now the last change. The one I take most seriously in my office. Hold up your 2 index fingers side by side, nails facing each other. Press the nail plates back to back. In a healthy nail, a small diamond-shaped window of light remains visible between the bases. Now imagine that window has disappeared. The fingertips look rounder and wider, almost like the end of a drumstick. The nails curve downward, and the tissue underneath may feel spongy. That is clubbing, one of the oldest physical signs recognized in medicine. Many people see clubbed fingers and assume it's arthritis, old age, or years of working with their hands. But clubbing isn't simply a joint problem or normal wear and tear. It can be a signal coming from deeper inside the body. Researchers believe that when oxygen levels are low or circulation in the chest is altered, certain blood cells can become involved in tiny blood vessels. Chemical signals may then travel toward the fingertips and stimulate tissue growth. The fingertips widen, the nail beds soften, and your hands become a message board. And what might that message mean? In many cases, clubbing is connected to conditions affecting the chest. including chronic lung diseases such as COPD and pulmonary fibrosis. It can also be associated with some heart conditions and less commonly digestive disorders. Lung cancer is another possible cause doctors take seriously, but please be careful with that word. Clubbing does not mean you have cancer. There are many possible causes, and some are treatable. It simply means your body may be asking for an explanation. That matters because timing can change everything. A lung or heart problem found early may offer more options. And sometimes you can feel completely fine while something is developing slowly inside your body. So what should you do? Don't panic, but don't ignore it either. Make an appointment and describe exactly what you've noticed. Your doctor may examine your hands, listen to your chest, check your oxygen level, and order further tests if necessary. If clubbing appears alongside a persistent cough, unexplained weight loss, chest discomfort, or breathlessness, make that appointment sooner. Not from fear, from the quiet confidence that early attention can help protect your health and independence. Today we looked at 4 changes: spoon-shaped nails, which can point toward problems such as iron deficiency; pale nails, which may sometimes reflect underlying health issues; horizontal grooves, which can record a past illness or disruption; and rounded fingertips, which deserve medical attention. But the real lesson isn't about nails. Your body talks to you every day, often in small ways we're tempted to dismiss. After 60, it's easy to say, "I'm just getting old." Sometimes that's true, but sometimes it's information. You don't need a medical degree to protect your health. You need attention, curiosity, and the courage to ask questions. You are never too old for your health to matter. The small things, staying active, drinking enough water, keeping appointments, and noticing changes can help protect your independence. We're not just looking for more years. We want more good years with strength, clarity, freedom, and the people we love. So, in the next 48 hours, take a close look at all 10 nails in good light. If something concerns you, talk to your doctor. If this helped, share it with someone you love, and subscribe for more honest conversations about healthy aging. Until next time, keep your eyes open and your hands in good care.